Hello, beautiful people. He is William Ruckelshaws, who was the first administrator of Environmental Protection Agency. He says, nature provides a free lunch, but only if we control our appetites. So his idea is similar to Mahatma Gandhi's idea that nature has enough for everybody needs, but not for everybody's greeds. Guys, this idea directly collaborates to Sustainable Developmental Goal number 12, which talks about responsible consumption and production. Moreover, guys, he is also a prominent example of integrity and conviction. He resigned from his position rather than obeying President Richard Nixon's order to shoot an independent prosecutor who was investigating Nixon's role in Watergate scandal. So guys, you can use him also in your ethics paper number 4. So please remember him for GS paper number 3 as well as paper number 4 along with your paper on essay. So guys, let's begin with today's discussion. Guys, today 1st of April, these are the list of articles that we will discuss today. Guys, a lot of editorials are coming on the hardship, miseries and failure of government. Please see 2-3 articles. We had discussed them, but please don't go too much into those details because that will not be useful for your UPSC examinations. Now let's begin with today's discussion. Guys, recently a conference held in Nizamuddin, Delhi, which was attended by thousands of people amid the coronavirus scare, and now a large number of cases are coming from that particular location, which has made Delhi a suspected hotspot of COVID-19. So a lot of articles are will be covering in this particular session. First of all, the news article is there on the page number 1 of the Hindu newspaper. Then a news item is there on the page number 3. And then there is an editorial in the Hindu and one more editorial in the Indian Express. So first of all, we will be going into the background which might be important for prelims, and then we will look that what could be the possible future course of action for the citizens as well as for the government. First of all, the organization in question is Tablighi Jamaat, which happens to be an organization which was formed during the time of Indian national freedom struggle. So, before tracing it, we will see the development of Devbandi movement from where Tablighi Jamaat has developed. So guys, Devbandi movement was a reformist movement which aimed to reform the Islamism, and the movement was started after 1857 revolt which was being carried against the Britishers. So guys, this movement was founded by Muhammad Qasim Nanautawi and Rashid Ahmad Gangohi. So guys, basically Devbandis are concerned with the spirit of education and reform into character. They asserted that Muslims have lagged behind, particularly due to the orthodox attitudes. So they asked them that they should come and should go forward with the reform. Now, the movement of Devbandi was primarily concerned around Darul Ulam Deoband, which happens to be an Islamic university, and it was the first base around which Devbandis started. Now, Darul Ulum Deoband is in Deoband, which is presently also a functional university. The university was founded in 1866. Now, one more thing we need to note about Devbandi movement was that these people believed in nationality and they were against the Britishers. So therefore, they also advised Muslims to cooperate with the Congress in their fight against the Britishers. Now guys, in this particular respect, Devbandi movement happens to be opposite to the Aligarh movement which was being led by the Sir Syed Ahmad Khan, because Aligarh movement and Syed Ahmad Khan, they advised the Muslims that they should not cooperate with the Congress as it will not be into the benefit of the Muslims. So guys, Devbandi movement was actually a reformist movement, and now Tablighi Jamaat happens to be an offshoot of the Devbandi movement, and it was founded by Muhammad Ilyas into the region of Mewat in 1926. Guys, though Tablighi Jamaat happens to be an offshoot of Devbandi, but they started their focus on reviving the Islamism, and they asked the preachers that they should go to the original habits, original clothing, and original customs which were being followed during the time of Prophet Muhammad. And they also talked about bringing back the people who have lost the way of Islam. So, Muhammad Ilyas, he also brought back Neo Muslims who were actually practicing the Hindu traditions into the fold of Islamism. So, it actually turned into a revivalist movement, and slowly the movement became a very influential, and presently it is one of the largest Islamic movement into South Asia, which has its headquarter in Nizamuddin. So guys, at regular intervals, a conference happens where all the people who are the members of Tablighi Jamaat or followers of Tablighi Jamaat, they come together and discuss the religious issues. Now guys, in the second week of March, one such conference was held in Nizamuddin, New Delhi, and the conference was attended by more than 2500 people. Now, after the conference concluded, a large number of people went back to their home countries as well as cities, but large number of people still stayed back into Nizamuddin. According to organization, they were not able to go back as lockdown was imposed, but according to government, well before the conference started, an advisory was issued that religious and social meetings should be avoided. Now guys, what had happened? In last 2 days, government is evacuating the people out of Nizamuddin, and more than 1500 people have been evacuated. Now guys, out of these 1500 people, nearly 100 people have been tested positive for COVID-19, and a large number of people are being held in quarantine where they have developed symptoms. So now a kind of a controversy arises that Nizamuddin could be a new hotspot of COVID-19, and as a large number of people have been migrated to their home states, it could be a possibility that these people will be spreading coronavirus there, and a community transmission could be expected, which might drag India into the stage 3 of COVID-19. So guys, here a question comes that whose failure actually it is. Though government has taken extraordinary measures, government has imposed National Disaster Management Act, Epidemic Disease Act, lockdown have been imposed, and tracing is being done by the government. But it is not only the responsibility of the government, rather responsibility of citizens is also very crucial at this point of time, because on their own understanding, they should go into self isolation, they should focus the distancing, they should go into the quarantine. But actually all these things are missing from the behavior of majority of citizens. Now, in the aftermath of this disaster, government is confronted with a Herculean task as how to track the chain of the people and to stop the pandemic of COVID-19. So now guys, the problem is there on three fronts. First of all, there is government to government cooperation is needed, because often the state governments are not cooperating with each other, due to which the operations are turning ineffective. Secondly, a cooperation is needed from government to people, where both should cooperate with each other and should understand the travesty of the times. And third, a cooperation is needed from people to people, where people should understand their responsibility and should not involve into profusion of fake news and panicking. Now guys, Indian Express editorial raises a question that during such crisis, why such carelessness is happening. So here we should understand that the Muslim community is actually very much vulnerable to a bigger problem. See, the socio-economic indicators are very poor, employability is very poor, education outcomes are very poor. Moreover, into the present times, due to government's policies, the trust has been broken. So even when the world is struggling with such an epidemic, the people, they are not able to grasp the gravity of the situation. So the act which has been committed in Nizamuddin during this particular crisis was an act of ignorance. Now who should be blamed for this ignorance? Now Partly, government could be held responsible because government had not paid attention to their socio-economic development. But more than the government, the editorial suggests that fault lines are there into the people themselves, because it is a fact that into the Islamism, the education is primarily dominated by the religious clerics, that is Maulvis and Maulanas. Now, madrasas happens to be a primary source of education where though the reforms are coming, but still the majority of education is religious. Now, a kind of an intellectual paralysis is prevailing the community. Usually, religious clerics looks with a kind of a disgust to modern education, but it is not the case. The great prophets, they always encouraged free learning, but religious institutions are not taking forward that precedence. Now, we should need to rethink that these religious institutions are actually helping the community, though intentions are very good, but in outcome, are they able to help the community, or they are going with the more harm? And at the same time, such questions should also be asked with the government, that with the array of policies which they are bringing, actually community is getting some advantage, or whether they are being pushed into ignorance. Moreover, at this time, the challenge is not just for the Muslims, rather the challenge will be for entire country. So guys, here this editorial particularly explores that though crisis has been caused, but partly it was due to ignorance, and that ignorance can be attributed to a greater system which needs an urgent reform. So this was all about this article. Now we'll move to the next article. Guys, this editorial has been taken from the Hindu newspaper, and it discusses the controversy surrounding the prospective drug for coronavirus, that is remdesivir. Now guys, this particular topic is important for prelims science and technology, as well as for your GS paper number 3, intellectual property rights. Friends, recently FDA, that is Food and Drug Administration of US, granted orphan drug status to Gilead Sciences, and from here the controversy starts. Now, before going into particular editorial, I would like to explain certain background, after which the things will be easier. Now guys, first of all, orphan drugs are those drugs which are made for the disease which are very rare. Because if a disease will be rare, then it will not be remunerative for a company to make drug, because large number of patients will not be there, and a company will not be able to recover the cost that has been incurred on research and development. So in that particular situation, government provides a special status to certain category of drugs, that is orphan drugs. What exactly are rare diseases? That depends on country to country. According to US Food and Drug Administration FDA, that disease is a rare disease which affects less than 2 lakh people. According to European Union's European Medicine Agency, a disease will be a rare disease if it affects less than 10,000 people. With respect to India, we don't have any law with respect to orphan drugs or rare disease, but the drugs will be called as orphan drugs which treats a disease which happens to less than 2 lakh people. Guys, there is no law. I said this thing. This particular thing has been mentioned into draft rules which was released by Health Ministry for clinical trials. Now friends, various incentives are given to orphan drugs, and in US, the orphan drugs are dealt under Orphan Drugs Act 1983. So, with this respect, a company which gets the tag of orphan drugs, they will be getting a 7-year exclusivity to make that particular drug. They will be getting various financial incentives. Moreover, they need not to submit pediatric study plan. So guys, pediatric study plans sees that what is the impact of a drug on children. Fine. So this periodic study plan is actually a very long process, and it can take nearly 210 days. Now, when an orphan drug is being made, so they get a relaxation from this particular thing. Now, what happened? Gilead Sciences, it is a US pharmaceutical MNC. Now they made a drug, and the name of the drug was remdesivir. Now guys, originally this drug was made for Ebola virus. And as you know that the number of cases for Ebola virus was not that much. So what happened? Gilead Sciences applied for a orphan drug status to remdesivir. Now guys, meanwhile a kind of a development happened that remdesivir turned to be effective to treat the disease of COVID-19. And as I had told you earlier also that now WHO had started a solidarity mission in which 4 drugs have been identified for COVID-19, and out of those 4 drugs, one is remdesivir. Now just a couple days back, FDA had even given the remdesivir an orphan drug status. Now there are certain controversies surrounding this particular thing. On one hand, there are people who are saying that Gilead Sciences actually want to make a huge profit and they want to take the exclusivity domain. Therefore, they are going for this particular thing. On the other hand, Gilead Sciences says that no, we had applied for this particular status because we want to avoid the state of a pediatric studies which will take much more longer in order to develop the drug. So in order to make the process more swift, we had actually applied for orphan drug status. Now guys, USA had given it an orphan drug status knowing this particular thing, that at this particular time the COVID-19 is such a big problem. But here US had it's their own third version. The FDA says that we had given the orphan drug status just so that the incentives could be given to Gilead Sciences so that they can swiftly complete the process and everybody should get benefit out of it. Now guys, the latest update is that Gilead Sciences had submitted a request where they are saying that the US FDA should remove the orphan drug status that has been given to remdesivir and they want to give up all the advantages and benefits they might receive here. Moreover, at the same time, Gilead Sciences is saying that they are also suspending their compassionate use program whereby they were giving free drugs to the people who are in dire need because there is overwhelming demand. However, they will continue their compassionate use program for children below the age of 18 years and pregnant women which are having severe COVID-19. Now guys, the question remains that how? Firstly, orphan drug status was given to remdesivir, which is kind of a drug for COVID-19 which had affected more than 8 lakh people, and what grounds USA had to justify this claim. Now guys, what will be the implication for India with respect to this particular controversy? Now guys, Gilead Sciences hold a patent in India, which means that only they exclusively can make a drug. In case orphan drug status was given to Gilead Sciences, then no manufacturer can make the drug for 7-year period. Now guys, even if the status is given or not, we have a clause in our Patent Act, that is section 92 of Indian Patent Act. Under this particular provision, government can give a compulsory licensing status under which generic drug manufacturers get a permission to make a drug even when the patent has not expired. So without the permission, generic drug manufacturers can make, which will drastically reduce the cost. So guys, this was all about the controversy of Gilead Sciences remdesivir and COVID-19 drug. Now we'll move to the next article. Guys, this article has been taken from the Hindu newspaper and it serves as a case study as what has been done into Tamil Nadu to contain the COVID-19. So yesterday we had seen a case study from Karnataka and today we'll see this case study from Tamil Nadu. Guys, these case studies are important as a part of your good governance under paper number 2. Friends, Tamil Nadu has taken various initiatives to contain the pandemic of COVID-19. First of all, Tamil Nadu has worked on their mass screening project. Then Tamil Nadu had went for proper monitoring and counseling so that even the people who have been screened and even they have developed the symptoms, they could be monitored and they could recover. Then after to contain the pandemic, proper lockdown has been contained and a surveillance is being kept to contain the COVID and to see that lockdown is not being breached. At the same time, proper infrastructure has been built which makes sure that the miseries of the people are reduced during this time. Then community participation has been taken with the help of self-help groups. Moreover, With respect to awareness, various important steps have been taken, and at the last, the government had also talked about workers and migrants as how they are being helped, and finally, in order to energize economy, various further steps has been taken. Guys, first of all, as we know that Kerala was the first state which recorded the cases of COVID-19. So first of all, Tamil Nadu blocked their boundary with the Kerala, and as the cases started to increase, Tamil Nadu blocked their boundaries with all the states. Here we can see Tamil Nadu shares a boundary with Kerala, then Tamil Nadu shares a boundary with Karnataka, and here Tamil Nadu shares a boundary with Andhra Pradesh. Please keep in mind that it doesn't share a boundary with Telangana. So all the boundaries have been sealed. Moreover, international passengers are being screened very properly so that they don't evade if they have the symptoms of corona. Now guys, after that, there could be a possibility that people might be coming through other airports rather than from the Chennai. So all the people of Tamil Nadu who had entered into country from any airport, the data have been collected, and as a result of these screening, all the people have observed under home quarantine for the duration of 28 days. Now, after that, there are certain people who could be high risk households. So, those households have been identified and stickers have been pasted into the front of residences so that the neighbors and other peoples can maintain proper social distancing. After that, guys, there are certain group of people who are actually more prone to the coronavirus. In this direction, the pregnant women, they have been screened, and nearly 1.5 lakh pregnant women have been screened who are due in next 60 days to see whether they have developed any symptoms. Apart from them, the patients suffering from hypertension, diabetes, HIV, TB, they have also been screened. Now guys, after that, all the people who are high risk, their households are being monitored 24/7 through our dedicated team of doctors through the medium of audio and video calls, and all the people are being given proper counseling so that they don't get scared by any panic news. Moreover, the lockdown as it was enforced by the government has been followed very rigorously by the Tamil Nadu government. First of all, Tamil Nadu government announced a lockdown on March 15 on particularly on the big commercial complexes, malls, theater, places of worship. So only these high risk institutions were closed for the first. Then as full-fledged lockdown was announced, Tamil Nadu government went forward with this particular development. Moreover, in Tamil Nadu, Section 144 has been imposed till March 31 so that there could be proper enforcement of the lockdown. Moreover, further this lockdown has been extended till April 14 as central government has advised. At the same time, coordination forces have been installed which are headed by senior level IAS officers to see how successful lockdown is going, and at the higher level a chief secretary has been given a role to monitor the preventive measures. After that, as Tamil Nadu is transitioning towards stage 2, it is very much evident to contain the coronavirus. Therefore, local containment plan has been devised where people are conducting door-to-door surveillance, which are the zones where the positive cases have been faced. So all the neighborhood is being checked there. Moreover, contact tracing is doing very much effectively, and passive surveillance is being conducted even to the people who are being suspected. And as we had seen earlier, active surveillance, the active cases are put under the quarantine facilities. Moreover, infrastructure plays a very important role in aversion of a crisis. So government has decided to set up a block hospital in Chennai which will be having a capacity of a 500 beds and proper medical equipment to treat the coronavirus patients. Moreover, all the districts which have confirmed COVID cases have given a dedicated hospital to treat the patients of COVID-19. Moreover, guys, the people who are suspected of corona but they are not actually tested positive, all the medical hospitals, medical college hospitals and district headquarter hospitals have been designated for those suspected patients. At the same time, essential infrastructure such as quarantine facilities, isolation beds, ventilator facilities, frontline workers, testing laboratories, doctors, nurses, and other medical staff has been ramped up so that the state should be ready to meet the crisis. Moreover, community participation plays a very important role during the time of crisis. So self-help groups have been identified in order to assist the government to manufacture triple layered mask and hand sanitizer to augment the supply, as right now there is immense demand for these products. Moreover, guys, at the same time, sanitization is also being given attention. Thermal screening is being done at the public places, highly populated areas, crowded buses. They are being disinfected so that the virus doesn't penetrates to other areas. After that, awareness happens to be a very important component, because if proper awareness will not be there, then it can lead to the profusion of fake news and panic. Therefore, state government had made a dedicated website, that is Stop Corona, where verified messages could be given. After that, frequent advertisements are being installed and hand washing platforms have been made into the region where there is public gathering. After that, at the level of minister, all the ministers have been given dedicated responsibility to prevent the disease, and a crisis management committee had been made at a district level under the chairman of district collector, where there will be the representative from other bodies such as Chamber of Commerce, NGOs. They will assist the government with respect to further course of action. Now, after that, whenever a crisis hits, then the most impacted section is the lower section, particularly the workers and the migrants. In this particular direction, a relief package has been announced where all the ration card holders will receive essential items, and 1,000 rupees transfer payment will also be given to them. Moreover, there are people who are in our organized sector. They will be also be getting essential items such as 15 kg rice, 1 kg dal, 1 kg oil, along with the transfer payment of 1,000 rupees. Moreover, Amma canteens are a very good example of state welfare. So Amma canteens will also be providing the food to the needy people. Now, one particular thing has been ignored by most of the states, that is the welfare of the migrant workers. Now, migrant workers from other states will also be getting the same commodities in equal measure. There will be no discrimination. Moreover, the vendors who also be given an extra payment of 1,000 rupees. Government has also taken care of children in Anganwadi. Therefore, they will be getting a 15 days of advance meal so that their nutritional requirements can be met. Migrant laborers, they are also being housed into the community halls and marriage halls, where they will be given all the benefits that we had mentioned above. Senior citizens have also been given food by the virtue of Anganwadi centers, and the people who are dependent on MG Narega, they will be given 2 days additional wages to cover for their expenditures. Moreover, there is a fear that economy will be severely impacted by this particular development. So Tamil Nadu has announced a relief package, and certain suggestions have been made to the central government, such as introduction of a 1 lakh crore package where 9,000 crore rupees will be given to Tamil Nadu. Moreover, after that, Tamil Nadu government on the lines of Kerala also wants that fiscal deficit norms should be relaxed for the year 2019-20 and 2021, because this is a time when the state government needs to pump more money into an economy. Moreover, state government should also be allowed to raise additional borrowings of 33% over and above last year in order to raise the aggregate level of demand. So guys, this was all about the things which are being done by the state of Tamil Nadu. Please keep these all things in mind as a part of good governance. So this was all about today's newspaper editorial analysis. Have a nice day. Guys, if you like our video, then please do share and subscribe to our channel. Thank you.